Hello and welcome to Business Disability Forum's COVID-19 webinar, which we are offering as a free resource to all during this time. I'm Diane Lightfoot and I'm Chief Executive of Business Disability Forum, and I'm delighted to be your host for today. Before we get going, I need to let you know that closed captions are available for today's meeting, provided by the rather brilliant MyClearText. And you can choose this by clicking the closed captions button at the bottom of your screen, which is next to the chat option. And if you need to adjust the caption size, you can click on the arrow next to the stop start video, choose video settings and click on accessibility. If you want to see the subtitles in full screen, there's also a link in the chat which has been circulated. And I think we might have that information on the next slide as well. There we go. And our subject this morning is supporting customers with communications difficulties, and follows on from the very popular session we ran a few weeks ago on how to support employees who are deaf or hard of hearing. So, as my guest today, I'm delighted to be joined by Kamini Gadhok MBE, who is the Chief Executive of the Royal College of Speech and Language Therapists. And Kamini will be sharing some top tips and advice for businesses in how to support customers, particularly with communications difficulties, and some considerations as lockdown eases and as restrictions change. So hello and welcome, Kamini.
Good morning, Dan, and thank you so much for inviting me to be part of this webinar. So if I just introduce a little bit about the Royal College of Speech and Language Therapists first. So if we could go to the slide about the RCSLT, that would be great. So that's me, for those of you who haven't met me before. I am a speech and language therapist by professional background, and my work at the Royal College I'm going to just highlight to you on the next slide. So the Royal College of Speech and Language Therapists is the professional body for the speech and language therapy profession across the UK. We currently have almost, or actually over now, 17,000 members. Our role is to promote excellence in practice and to influence policy with respect to those areas that affect people who have communication needs. So our members work with both children and with adults. So obviously it's really important that we support those children preschool who might have difficulties with learning to communicate, as well as through their lives as they go through the education system, through to employment. And we also work obviously very much with adults who may have learning disabilities, as well as those who might have a range of conditions which might have occurred as a result, for example, if you have a stroke or if you have Parkinson's, MS, and head injury might result in having requirements for communication and support needs from a speech language therapist. We also work with people in the justice sector. So yes, it's quite a wide range of people that we do work with.
And I think you've been very, very busy and working at pace. And often actually a lot of your members on the front line during the pandemic and COVID-19. Can you tell us maybe a bit about that?
Yes, I think it's been everyone keeps calling it a strange time. It's been strange and also quite anxiety provoking, I think, for many people who are on the front line. This is a new virus. No one has known the impact of it on people who contract it. We hear that there are many people who might be asymptomatic, which means that they might have the virus, but actually they don't even know. So you've got a whole spectrum from people who don't know they've got anything to those who end up in ICU. And I think you've seen a lot on the news around patients who end up being sedated, which means that they are in a coma, in intensive care and on ventilators. And many of our members are working in hospitals in intensive care units and in what's called step-down beds, so when the patients come out of the ICU. We also have a number of members who are working on general wards in hospitals where patients are too frail to go into an ICU. I think in terms of context, it's really interesting to know that normally a long time in an ICU is thought to be 48 hours. With COVID-19, patients are in there from 3 to 4 weeks. So, you know, that length of time means that your muscles are wasting. You will have an impact because of the virus itself, we know, is affecting people's breathing heavily, their respiratory function. And as they're being intubated, many of them have, when they come out of ICU, have significant problems because they've had damage to the larynx, or what you might know as the voice box. So that results in difficulties with the voice, and also problems with eating, drinking and swallowing. However, there's other needs that we've identified more recently. So some have neurological difficulties, so their brain will have been damaged, and some are having stroke. So it's quite shocking, actually, when you think of that range of difficulty that somebody might have. And yes, so there's, you know, I think when as we're coming out of, or we're looking at how patients come out of hospital and looking at their rehabilitation, many are quite young. So I'm sure that your colleagues who are providing services will see that they'll have people who have a range of disability who are much younger than some of those that you might normally expect to see.
Mm-hmm. And as you say, the sheer range and spectrum of going from being asymptomatic to what you just described is so difficult to manage and actually quite horrifying. I didn't know all those different impacts. And moving on specifically then to COVID-19 and people with communication needs, if we go on to the next slide and perhaps the one after that. Obviously, the impact of the pandemic and lockdown has been really significant on everyone in the UK, and in particular for people with disabilities which are not immediately visible. We hear on our advice service lots of difficulties around people, say, with sight loss, who cannot guarantee that they'll maintain social distance in a shop, or equally people with dyspraxia who might find it hard to judge distance or picture what 2 meters looks like, but also people who have other communication needs that might not be immediately obvious, if at all obvious.
Absolutely, Dan. And I think what's really interesting is we're seeing an easing of the lockdown. We're also working with our members to restore services. So I think everyone will have heard on the news that there are many NHS services that have been halted or been reduced, I guess. And we've seen that people who are shielding are now able to go out and about. So that will include some of those that you've just mentioned. But also, as you said, a significant proportion of the UK's population. And on this slide, it highlights that up to 20% of people can experience a communication difficulty. So that's over 13 million people. And many will be invisible because they will occur with a range of conditions and across a whole a range of age groups. So it's really important that when we think about the easing of the lockdown and businesses opening up, particularly face-to-face opportunities for people to go out and shop or socialise, that it's really important that we think about the needs of those who are more at risk and are more vulnerable.
And many of people who are transitioning from what has been sort of quite clear rules during lockdown to a very shifting and less clear picture may also find that really difficult to understand and cope with. I was thinking about people who have found it very, very difficult in lockdown and changes to routine, and maybe, say, for example, people with autism who may have a completely different lifestyle and find it very difficult to understand what's happening or the changes in routine. And how can businesses, how can we just be a bit more mindful of that, really?
I think you've made a really good point, and in fact people with autism are a group who very much are invisible in terms of their communication needs, and that will be the same for, say, someone with mild Parkinson's or a stroke, but the needs will be very different. So if we go on to the next slide, we can start having to think about what we can all do and what we need to think about. We're very aware that public health messaging has not always been consistent or in very accessible formats. And as you said, as a result, people might not have understood or may even have misinterpreted the measures. So I know a family near me whose son is a young man who is on the autistic spectrum, and he's found the lockdown very, very difficult, and they've had real difficulties with his understanding, particularly when you were only allowed to go out for an hour, that was the restriction. And he found that very hard. And I think, as you said, that now that he's apparently very much looking forward to going to the shops, but will he understand that social distancing? Certainly when we've been out clapping for the NHS in the evenings, he has come and stood very close to neighbours. So I have a sense that he probably doesn't understand that social distancing rule or best practice that we're being told to follow. So it's important that we think about how we approach the messages that are given when people go out. And it might not just be somebody who has a communication problem. I'm sure this will apply to others. I know when I was out recently, there was an elderly man who came, and even though there was a lot of space around me, he came and stood right next to me because I guess that was his norm, and he clearly hadn't got or accessed that message about the 2-metre social distancing rule. So I think that's been, you're right, that's been a real challenge and will be a challenge. We're very aware as well that people have become increasingly reliant on online services. So there's an opportunity, I guess, to think about messaging and supporting access through other routes if face-to-face or physical access to shops might still be a problem for many.
And of course, while people who have been shielding are now allowed to go out if they wish to, they may equally be very nervous about doing so. So actually knowing that they can get provisions in different ways is going to continue to be really important. And I'm really struck about your point about misunderstood. And I think that point is very important, and it's important around a whole kind of spectrum of disabilities and actually subjects really, and that it could be very easy in the situation that you described with that other customer coming very, very close to you unnecessarily when you've got a load of space around you. It would be very easy to jump to the conclusion that that was deliberate or malicious or at best, you know, thoughtless or something, you know. And actually taking a moment for us as other customers, but also for businesses, customer facing businesses, to think, actually, hang on a minute, maybe this person just doesn't understand, and they're not being deliberately awkward, and they're not doing it wrong. And this equally applies for all sorts of communications differences in all sorts of spheres of life, really. So how can businesses best reach people who are still wanting to shield and remain inside, and also those who have communication needs? So so far it's only essential services that have been open. I sort of laugh at the idea of a garden centre as an essential service, but that is, 'tis what it is. But actually, we're going to have many more retailers, non-essential, able to open from next Monday. And those who have been open as essential services the whole time had to shift overnight pretty much, didn't they? And to get to grips with new ways of working, virtually overnight, on the hoof, feeling our way, really. But what can businesses who are now starting to open, what can they learn from the experiences of those who've been doing it now for nigh on 3 months? And how can they prepare and learn and make sure that their staff are prepared?
I think there's some really important points there, Diane. I guess that it is good to see how other businesses have already responded and to learn from both the things that are going well and not so well. So I think you mentioned just earlier about something about other customers also respecting that somebody might be standing right next to you. Like I realised that the elderly man, he wasn't being malicious, he was just clearly hadn't understood. So I was the one who walked away and made sure I socially distanced from him. Obviously that might not be possible to try and make sure customers understand that in every place. But, we have noticed things, that measures that have been put into place. So if we go on to the next slide, I think that might help to start us on that conversation, really. So there's something about, how do you reinforce, particularly like the social distancing rule, of 2 meters, in a way that is accessible to everybody? Is it by having markers on the floor? Is it by having signs that are in accessible format so that people understand? I've certainly seen signs where, which are figures with an arrow which says 2 meters in distance. But it's important, I guess, to have a think about what would be helpful in your business to help to keep that message very much at the forefront, I think, not just of the customers, but also of those who might be serving them, so that everybody remembers that it's not just the customers who are coming in and the 2 meter rule, but also the staff with each other. And that 2 meter rule applies to all of us. Certainly in the NHS, they found that where mostly coronavirus has been spread is when the staff have been in the staff rooms with all their PPE off and sitting very close together. So it's, so they're creating this rule about social distancing in any environment in the NHS. And I think that same rule needs to therefore apply. So thinking about how, as I said, you can think about accessible formats, and we can talk a little bit about that in a few minutes, but also thinking about how communication engagement happens in a way that is accessible and inclusive. So, what's the approach to supporting people to understand that that whilst they might want to ask something, they still have to try and ask what they want from 2 meters away, which might, of course, be a challenge if you don't speak very loudly or if you yourself have difficulties with hearing. So I think that there are some areas here that need to be further explored, and you and I can talk about that in a minute.
Yes, definitely. And I think your point around the staff rooms is fascinating, because when I talk to people, like having numerous sort of Zooms and Teams social calls, there's almost this sort of feeling that it's okay with people because people we're looking forward to seeing people we know, because, well, they're fine, aren't they? Whereas the people that we don't know on the tubes and the trains, we are wary of, and we think about the distance. But actually, when you talk about the fact that some of the people who have COVID, it's asymptomatic, that makes absolutely no sense at all. So really, that discipline is so important, and also hard for people. I do really get that.
Yeah.
So if we go on then to some suggestions around, some tips around accessible communications. I think we have that probably on the next slide. So Kamini, can you maybe talk us through some of the points here?
So we've got some more detail in the following slide as well, but just to start with, some top tips, I guess, as a starting point is, think about the language that you use. So really important when you're talking to somebody and trying to explain any rules. If you do not know if they have difficulties understanding you, think about how you can communicate using clear language and using short sentences, trying not to use jargon. I don't even know if everybody will understand 2 meters. I mean, I'm not very good at this personally, so that's why I'm saying that's why signage, as we know, is very helpful. So it's clear then it's important to have easy to read and plain English where signage is used, and to think as well about the way that you space out the words on any written material and the font size. So there are examples, for example, that font size, the minimum should be 14, so to help people who might have difficulties with vision in particular. Also things like having a light background and dark print helps messages to stand out if they're written messages, and thinking, as I mentioned earlier, about images and symbols and making those very easy to access. And I think it's a combination really of all those factors that will help people who have communication, and also those who do not have specified communication difficulties, but to help those people who haven't understood those public health messages to really get to grips with what's being asked from them. As I said, we've got some more detail on the next slide, but I don't know if you think that asking people to consider their language in particular, Dan, if that's going to be a change, do you think, for most?
I think it's really important, and we also talk about it a lot in relation to neurodiversity, and again, people on the autism spectrum, and not talking in colloquialisms or jargon, and being, you know, really, really clear. And you saying about people not understanding 2 meters, I was wondering about your elderly gentleman who might very well still think in feet and inches, so it might mean to him 2 meters. And I did hear someone use the example that rather than saying if you're in a supermarket you need to stay 2 meters away, say you need to have the length of 2 shopping trolleys. That might be an easier way of people visualizing it, perhaps. And on the simple language, I think I should say here, sort of full disclosure, that before I joined BDF 3.5 years ago, I spent 13 years at a learning disability provider organisation. And Easy Read is something that I have grown to know and love. So the use of pictures to support understanding, and very simple, very plain English with sort of one idea, 1 point per sentence, is brilliant for people with a learning disability. But it's also brilliant for anyone who doesn't have English as a first language, or anyone who's time poor. And I was always struck when we produced reports. You'd have the full report that would be, you know, umpteen pages long, maybe size 12 or 14 font. And then you'd have the Easy Read that was maybe a few pages and maybe about size 18. And the amount of people that read that to actually get the nub of it, because it was quicker and because it was clearer and they didn't have to wade through all the text, was huge. So I think I would really like to get across to people actually on the webinar and who are downloading it later that this isn't just about making adjustments for a small group. It actually will benefit most, if not all, of your customers. Anyway, sorry, I got a bit on my soapbox there, Kamini, sorry about that. So then going on to, you've got here face-to-face communication and over the phone. I think this is really interesting.
Yeah, but I actually agree with you, Diane. As I said, the elderly gentleman who was standing next to me, I don't think he had a communication need. You know, he probably, as you said, I think you're absolutely right. I don't know if he understands meters. We make assumptions, I think, that everybody's on a certain level in terms of their ability to access information, and so this is about supporting everybody, actually, and certainly, as I said, what I've observed even with shop assistants is they haven't themselves understood the 2 meter rule. So clearly it is something for all of us to think about how we get these messages across, because it's not normal human behavior to stand so far away, you know, and you know, we're used to queues, of course, which is a good thing. So certainly in one shop, you know, they were very diligent at having somebody who stood at the front, made sure that everyone was at their marker, the 2 meter marker that was on the floor, and people, you know, got, you know, so I suppose it's changing that habit, you know. So the way we now do things is, what I think is interesting is, as you're going around, as I have in one shop, you know, finding that you are inevitably bumping into other customers. So I like your idea of trying to keep at least a trolley apart, because that might help. So as you said, actually this is for all of us. So let's go on to some of the more specific tips, I guess. So, you know, we've talked about the fact that you think about how you use printed material, the font size of those, and what you can do to make things clearer in terms of using simple and plain English, and obviously doing that without patronising the person you're speaking to. So we've used an acronym called TALK for the work that I'm going to talk about with you again in a few minutes, and I think that's just helpful to, as an acronym, to remind people of the things to think about, really. So T is about time. I think, you know, when people are struggling with understanding what's required, it's really important to give people time both to understand what's required, whether it's because you're asking them to do something, or giving them time to look at their environment and take in the signage, which might be new, to understand the new layout, if you change the layout of your shop and how they're going to have to walk. We know that you gave the example of garden centres have developed one-way systems, I understand, to help customers go through. Well, people need time to understand all that change. But also time for the person to speak. So if they need to ask for something and they are confused by the changing environment, and as I think you said, Dan, this would apply to anyone as well as those with communication needs. But obviously with somebody who with a communication difficulty, they might need that bit longer. So being very patient, I think, is the word I would use here. Being alert to the fact that somebody might have that difficulty with either understanding what you're saying to them. They might have difficulty with reading what's presented in written material, and they might have difficulties with speaking clearly, which means that the person who's communicating with them needs to, as I said earlier, be patient and give them a bit more space. Does that help with the time element, do you think, Diane?
Yes, definitely. And while you were talking, I was thinking about a podcast I recorded a few weeks ago with Ian Wilkie, who's the founder of the 50 Million Voices campaign around stammering. And he himself has a stammer. And he was talking very much around the same thing about being patient and giving people time to communicate rather than trying to rush in and preempt. And I think, and he was talking about this, but I think it applies here too, that there's a thing around sort of owning and being at peace with our own discomfort while we wait for somebody to be able to communicate with us in their own time, rather than trying to jump in and talk over them and try and second guess what they might be trying to say, but actually that living with that discomfort and letting them have the space to communicate themselves. I also think, just in terms of communication around COVID, for all of us, it's really scary. And actually the simple and plain English and having a message which is really consistent and is repeated is, again, it's important for everyone. So I don't think, again, that businesses listening to this should think this is something necessarily that is for a few, and undoubtedly there are additional provisions for the few, but it will benefit everyone. One thing I wanted to ask you as well is around empowering frontline staff, because as you were talking, it was occurring to me that say in a supermarket or in a shop, many of the people who are on the front line will be junior staff members, and actually making sure that they feel empowered to say to somebody, you need to be a bit further away from this person, and to explain that and know that they have the license to do that, I think is important, because it's very easy for us in a leadership position to assume that's just okay and that they know that they can do that, but I think it needs making explicit.
Yes, I think we're all very polite, and even though as I said, I observed some behaviours from some shop assistants that I thought, ouch, you're just breaching the rule yourself. How do I say this to you? We're all very polite, but I guess it's about being polite. So it's about giving permission to politely say, oh, I'm really sorry, but we're wanting to observe this, or the 5 meters. Gosh, I've just changed the rule. The 2 meter rule. Yeah. I think it's really important, I guess, to have the conversation with your staff about what feels comfortable and what feels comfortable in terms of making sure that whatever you say and how you approach your customers is done in a positive way. So obviously, because what you don't want to do is anger any customers, but definitely having the patience and being polite. I think one of the things I have noted in this lockdown period is the need for patience per se. We're all now getting used to having to queue before we can get into a shop. So I think maybe that's something we all got to learn, is how we everything's going to take longer. So in a way, this is a good time to introduce some of these approaches, which we would hope would become embedded, I guess, in how the businesses who are looking at what they do for the future, how they would work with those with communication needs, because this requirement will continue for them going forward. So, as I said, in a way, it's a way of us shifting how, we keep talking about the new norm. This is going to be around for a while, so this might be an opportunity to think about what training is given to staff about how they communicate, as well as what they need to do around social distance measures. And one of the things that we were going to talk about under the acronym was the A, which is the ask. So it's also important to say, okay, if you're training your staff, how do they feel comfortable to say to somebody if they're finding it hard to get their message across, is there something I can do to help you? I'm not hearing what you're saying, or I don't understand. And maybe to have a piece of paper and a pen at hand if required. Obviously, that in itself has contamination issues, says Kamini very quickly, thinking about COVID-19. But that's something that we can think about, is what's the thing that would help? Do they themselves have a communication board that they could use, for example? So that's something that we can, certainly explore with you further as well. Certainly, I was talking to members now about what happens when a speech therapist goes into somebody's home. Normally, we would take resources and materials. Now, if they get contaminated, they'd have to be thrown away. And you can't assume, as we said earlier, that they might not be contaminated. So obviously laminating everything so that it can be wiped down is going to be something that you'd have to think about, so that if you do want someone to use, to point to a picture, that can be appropriately managed in terms of the current pandemic. So I think there are mechanisms definitely that help people to use whatever communication means they would want to help them get their messages across.
Yes, that's a very good point. And while we're talking about face-to-face communication, I know we also wanted to touch on the perhaps unique challenge posed by the use of face masks. And there are lots of different information out there on face masks at the moment, and our advice service is actually putting together a pretty comprehensive briefing that will be available shortly. But they do undeniably pose problems for people who have difficulty with communication, particularly people who lip read. And I do think that many more people rely on lip reading to support their hearing than perhaps they realise. But clearly for people who are deaf or hard of hearing, that's a very big issue. And people who struggle with communication generally, as the masks are likely to muffle speech. And then let alone people who have sensory issues and don't like the feeling of them and don't understand why they need to wear them. And I wanted to make a quick plug for a survey that we've just put out to all our members and partners, but is on our website, asking whether you would be willing to recommend or mandate and or purchase face masks that have a transparent window to enable lip reading. So please do have a look around that. And we were approached by the National Deaf Children's Society to try and raise awareness of this. And I know that it's something that is also an issue that you've been looking at, Kamini, isn't it?
Absolutely. In fact, it's one of the things that we've been talking about every day in our daily stand-up calls is about what can we do to lobby government to try and really push to get some of the masks that are being manufactured to be tested. So we obviously are very aware that any mask that's used has to go through a health and safety testing and be approved really through government. So we know there are some manufacturers who are trying to develop these. As you say, Dan, the use of masks is really a problem. It's a problem for our profession as we work with people with communication needs. Obviously, a young child you can't really work with a young child or even an adult on their communication needs if they can't see your face and your mouth. It makes life very difficult as a profession. But also, as you said, for people who are finding it hard to hear what's being said anyway, or have themselves got hearing difficulties, or may not have a hearing difficulty, that it's going to add to the barriers around communication. So this is a really important issue, actually. So I'd be very keen to know what your colleagues think, and yes, if we could work together to continue to lobby for those to be available, I think that would be incredibly important. So I think yes, when we talk about some of these acronyms, it was in the context of no COVID. We now have COVID-19, and actually it creates a whole new challenge, doesn't it? Which includes, as you said, about muffled voice if you're wearing a mask, and therefore how do you support better access to what's being said by the person, maybe the shop assistant, but also the individual who might have gone in and they themselves might be wearing a mask. So yeah, challenges both, I think.
On a sort of lighter note, I was chatting to my mum, who ventured out. She's in her 70s. She ventured out for the first time a week or so ago to a shop, and wearing a homemade mask. And she said she smiled at somebody and then realised that they couldn't tell that she was smiling. And I pointed out that a real smile goes to your eyes, so they probably did know. But there's all sorts of things around human interaction that are hidden. And for people that rely on, all of us actually, on visual cues as well, those are lost. So there's huge issues around that. But sort of not moving away from COVID-19. But although COVID-19 has thrown some of these issues into really sharp relief, actually supporting people with communication difficulties is not a new issue at all, is it? And we know that there is a massive lack of awareness of disabilities which are not immediately visible. I should say, of course, our members are very much on board with that. And to raise awareness of that, you and others, including BDF, have been working on a new communications access symbol. Can you tell us a bit about that? And I think that's the next slide too.
Yes, thank you, Dan. So, as you said, we've been working with the Business Disability Forum and a number of prominent service user organisations, and they include the Stroke Association and others, to really look at how we can support basically trying to raise awareness of the issues around communication disability, and also support access for those people who do have a communication disability to a whole range of services that I guess many of us just take for granted. So we're very aware of the impact that the wheelchair access symbol has had, and the hearing loop symbol, to get businesses to really think about access to the services they provide. So we've been working with all these partners, but also more importantly with those who have communication disabilities, to come up with a symbol. So this slide shows you what that symbol looks like, and it's called the Communication Access Symbol, and we're aiming to launch that fairly soon. We were actually hoping to launch it this month, but with lockdown that's been very difficult to do. But we are going to have to think about how we can pick that up again fairly soon, because I think the more we go on, it's going to be difficult to know how we can keep putting off the launch, if I'm being honest. So it's something I think we should really look at, because this is becoming very important as a symbol that we think really is required at across all organisations and businesses in particular. So in terms of supporting businesses, we do have an e-learning package, and we've been piloting this e-learning. So it's been piloted again with shops and with banks and other business facilities, including actually leisure centres. So it's the training itself has been really well received, and the aim is to get that available for free, and be supporting those who want to help provide a more accessible environment to learn how to do that and provide training for their staff. So I don't know, Dan, if you've got any comments you want to make about that.
Oh, well, I entirely welcome it. So I was approached by the Stroke Association to get involved right at the beginning, and I just thought it's such an important thing to raise awareness of. And we are seeing across, lots of signage, things around disabilities. Remember, not all disabilities are immediately visible, but there is a gap in terms of a symbol that says, actually, we understand and we are welcoming of customers who do have communications difficulties. And as you say, the wheelchair access symbol, the hearing loop symbol, the visual impairment symbol, they're all very well recognised and embedded. And I think the thought that's gone into developing this so it can sit alongside those, and also the involvement of people with lived experience themselves, and testing with businesses, because we have tested the idea of a symbol with businesses, and also the training, haven't we, to make sure that it really is meeting needs and genuinely co-produced across the piece. I think that's really important. And I also think your point about delaying the launch, when all this lockdown first happened, I think our natural instinct was to delay everything, but I'm increasingly seeing people saying, well, we have to move on, life has to go on, business has to go on, so let's do it virtually, as indeed we're doing today. So I'm very much supportive of let's get it launched and get it out there, and very happy to promote it to our members too.
Yeah, thank you so much. That's interesting, and I'm sure Naj, who's probably listening to this, is thinking, pardon? So, that was something that we can pick up as a partnership, because it's Naj is our project lead on this, because this is a really important piece of work. And yes, we're not quite sure when everything will really go back to normal, are we? And we are very aware that there may in fact be a second surge. So there is something about how I think this work would help generally in the context of COVID-19, as we've talked about, for all customers and for all businesses. So I would hope that it would actually add value significantly at this point in time. And so thank you so much for giving us the opportunity to talk about it, Diane.
Well, pleasure. Thank you very much for joining us. And I know that there are lots of resources that you have got to share that are freely available. So we can share those towards the end. But looking at the timing, shall we see if there are any questions from anyone who's on the webinar? And Kamini, thank you. That was absolutely fascinating, and some of it quite scary, but yes.
Thanks.
Hi, yeah, we've got some questions. So I've got one here about examples. So what examples have you seen of businesses who are doing good work in this area at the moment?
In terms of, well, I don't think I've proactively gone out and had a look, because I've been, if I'm honest, absolutely drowned in work guidance for our members around COVID-19. So, but I think this is something Diane and I were talking about earlier, actually, is what can we do? What can we share as a Royal College with the Business Disability Forum about the era that we're currently in, the virus, what we know about the virus, and then how that then translates to how businesses could respond, and what that means in terms of customer care. And as we said, that customer care actually would apply to everybody, because it would be about good practice. So certainly when I've been out, I think some of the things I mentioned earlier about someone being at the front of the queue, some member of staff being at the front of the queue and helping people to understand social distancing and having markers on the floor is something that helps, because you've both got a visual prompt as well as an individual who is reminding people and supporting people in a very nice way, very constructive way. That seemed very positive. The other things that I've seen are, I guess, if you're actually at the pay desk, at the checkout desk, what the size of that panel might need to look like, so that there is an opportunity to be able to speak, but not. Somebody told me that they went into somewhere and there was a huge perspex screen, but then there was a massive hole in the middle, which is absolutely defeats the object, really. So I think, as I said, I think it'd be something that Dan and I could explore a bit further, if that's helpful.
Yes, definitely. And we have a customer task force which has met a couple of times actually since lockdown, and it's Chatham House rules on the customer task force, but the businesses who are there are really, really keen to get this right. And at the moment, a lot of them aren't able to operate in the normal way, but as lockdown eases, they will be thinking about that. So I think perhaps maybe a session with that task force, Kamini, if you or one of your team was willing, would be really good. And I know that one of your colleagues, I think Catherine, came along to one a while ago when they actually met physically to talk through the communications access symbol. So actually, I think in the context of COVID-19, that would be something we should pick up again, I think.
Okay, good.
I also saw chats. I have to say on the chat, I saw Jim, hello Jim, saying lots of judging distance, so the two shopping trolley description is much more effective. Bless you, Jim, thank you.
Yeah, I was just going to mention that actually and say that I think some supermarkets are using trolleys as a visual description, which I think is working well for everybody really who struggle to visualise what that 2 meters looks like. Super. So I've got a question about small businesses. So there are many small businesses out there who are struggling to work out how to open safely as it is. So how can small businesses be supported to communicate better? And how do they know, how can we help small businesses know where they need to go for support?
Is that one for you, Diane?
I think a lot of it comes down to staff training and empowerment. So that point about the social distancing, it means everyone. And it is not natural, and reinforcing that, and also putting in place behaviours that make it okay to politely, nicely, but respectfully challenge. And I'm not sure if it was when we were doing a prep for this call, Kamini, we were talking around in the medical profession where there is role playing to say that, so that if somebody forgets to wash their hands or use a hand sanitizer or something like that, that every other member of staff is then empowered and role plays to make it more sort of embedded, to say, oh, you forgot to use the hand sanitizer, or actually you're too close to me, and just building that in as the norm. And apparently, I wish I could remember the conversation, the fact of role playing it had a much greater impact on it actually being enacted in practice. So it is that sort of thing. And I think also, and this is not just about communication difficulties, but that kind of always, before you make a reaction, think, is there something else going on? And I say that a lot around employment as well as the customer piece. And if somebody doesn't do what you expect, doesn't communicate how you expect, or whatever, rather than jumping to a conclusion that they are being difficult or awkward or something, just taking a step back and say, do they need something else from me? Maybe they haven't understood, maybe they communicate differently, or whatever it is. And that's quite basic really, but it's reinforcing it. And I think that the TALK acronym is a brilliant one, and actually if we could maybe share that around, and it could be something that is visible for frontline customer facing staff, whether it's in a staff room, whether it's by the till, that's just a constant prompt that somebody might need that bit more support. I think that would be really helpful.
Yes, absolutely. I'd absolutely agree with you, Dan. And I think the whole idea about checking whether people have understood, one way of doing that is to ask the individual, if you're not sure, just to say, particularly if you're doing staff training and supporting staff to understand themselves, because as I was saying, I'm very aware when I've been into one shop that a staff member hadn't understood, that they themselves role play. So I think role play is a really good idea. We're going to talk about how we're going to do this, and whatever you might use. I know there's been so many approaches to look at how you visualize that 2 meter, and trying to understand, well, in your normal day, even if you role played in your normal day, what are the different scenarios you might come across? Okay, so here are the basic rules. There's something about 2 meters. There's absolutely something about keeping, washing your hands and sanitizing your hands, and looking at decontamination if things are being touched. So if these are some of the key elements around COVID-19, and how do you translate those into the day-to-day running of the business? So that's something that certainly we're encouraging all our members to do. It's a similar thing, is, you're normally going out, as I said, going out into people's homes with equipment. Well, that could get contaminated. So I mentioned laminating things, what can you do to try and reduce the risk of transmission, but also normalize some of these behaviors? So I absolutely agree that I think role play is good. And one of the things we're encouraging our members to do is to have daily stand-ups, so that they have, conversations, and keeping that fairly relaxed, to say, rather than being getting people to feel defensive that they might have got something wrong, that might help with that culture shift and that behavior shift of, you know, did we all manage to do it? Did anybody, you know, how did you find it? What are the things that you can do to help keep that those sorts of ideas or rules of ways of working in your head? Is there something else? So I think that constant feedback from staff, and certainly that's what we're doing with our members, is what else do you need? Okay, how else can we help you? And of course it's a moving situation. So, you know, you mentioned right at the beginning that we've been having to work at pace, and wow, it has been at pace to get guidance out. So we've worked with some of our members to say, well, none of us have ever done it before. You know, there isn't a here's one we made earlier, or, you know. So, but however, we have seen businesses restart. So maybe there's something about learning from those businesses that have restarted to see what could be applied, for example, to smaller businesses. And then where there are more challenges for those smaller businesses, what we've done is come together with members, again, similar concept, to say, what are the barriers? Okay, let's be creative around some of those solutions, and having those conversations and sharing ideas and sharing innovative approaches, I think, is one of the ways that certainly the you know, the industry can work together. And I think through your leadership would be fantastic. Sorry, just giving you a load of work potentially.
Yes, and it's been recorded as well, so I can't pretend that we didn't have this conversation. I think that all sounds absolutely sensible, and I forgot one crucial thing actually about the role playing. Yeah. Which was that when the person who is reminded that they haven't washed their hands or forgotten sanitizer, they then say thank you. And it was particularly trying to, and successfully, embed it being okay for a junior staff member, in this case probably say a junior nurse, to say it to a senior staff member, so for example a surgeon or a consultant. And I think it's all going on here, sorry. And I think the same applies in different businesses actually. So making it, you know, you respectfully remind somebody and they say thank you. And that just becomes sort of a norm and a part of the culture. And I would also really love to hear examples, either today or as we continue, from businesses and how they are supporting customers and how they are innovating, because I'm sure there will be some really interesting creative ideas that we can share.
Great.
Have we got time just for one more question?
Oh, I think so.
Lovely. It's related to the communication access symbol. So somebody's asking if they are able to use it as of today, because they're really keen to put it on their website.
Well, they would have to go through the training first and meet the standards. I can, if they get in touch with Diane, I'm not sure when the online training is going to be available, so I'll need to talk to Naj, because obviously the training is a core part of it. So it does tell you how to register your interest in the slide. If we go up one slide before any
previous slide. Yeah.
The previous slide, sorry. There is a link to registering your interest. So I think if people could do that first, and I will certainly, when I get off this call, have a conversation with my key member of staff, as I keep mentioning his name, Naj, about where we are with the e-learning. We are working to put that on a website at the moment, so there'll be a timing issue. But that's brilliant that you're so interested. So that's fantastic.
That is great. That is really great. And for the registration, it's info@communicationaccess.co.uk. So do get in touch. And thank you ever so much for the interest. I mean, that's great. So we are pretty much out of time. So I will wrap up in a minute. But Kamini, any last thoughts from you before I do?
No, I think what you've just said, Dan, is just to reinforce that now is the time for innovation and creativity. You know, we've just all got to do things differently, and certainly when all this hit as a pandemic, that certainly was my first thought, even from our perspective, where as a Royal College had to start working differently, but actually we're managing to do things really well. So I think I would encourage businesses to really think creatively and work together and share ideas, as you've suggested, Dan. So thank you.
Thank you, Kamini. And thank you to Naj, because obviously my eyesight is not as good as I thought it was, because I missed a hyphen. So the actual email address is info@communication-access.co.uk. Thank you very much, Naj. So do check out the resources that are available from the Royal College of Speech and Language Therapists. Do also check out our own COVID-19 toolkit, which includes information on considerations for businesses as we move out of lockdown or whatever the next phase is being called. It's regularly updated. It's free to everyone, so please do share with others. We also do have a toolkit called Welcoming Disabled Customers, and if we haven't already, I think we will be adding some of this content to it. And thank you very much to everyone for joining us, but particularly a big thank you to my fabulous guest, Kamini Gadhok MBE. It's been fantastic having you with us, Kamini, and I hope this will be well, not the start, a continuation of even more collaboration and working together. So thank you ever so much.
Oh, thanks for having me. It's been a real pleasure. Thanks, Dan. Take care, everybody.